Today I'm talking about pain. Pain. People always talk about pain and want to go through pain so fast. Someone may ask you what is pain. In English, every person talks about pain. And if you ask a person what is pain, a person becomes confused. So I will say this pain is an unpleasant sensory and emotional experience signaling actually or potential damage. You get it? Experience that is signaling actual or potential tissue damage. There are several types of pain. You want to know where the pain comes from and where it radiates from. You see, it's very important types of pain. I have a headache. Where is it radiating from and where is it coming from? Let's know. Let's get to know. I, I repeat about pain. It's an unpleasant sensory and emotional experience. So it can be sensory or emotional experience signaling a potential or a tissue damage. So tissue, tissue is what a tissue is. Let's go. Yeah, we're starting with chest pain. When you're having chest pain may be signaling heart attack. Angina, we call it angina. Chest pains are called angina. It may be signifying pulmonary embolism. Embolism is segments in the pulmonary region or the vessels that are bringing blood to the pulmonary area. Yeah, they are blocked, so the heart is not receiving enough oxygen, so it suffers ischemia. So you feel pain. And this pain may be radiating to your arms, jaw, sweating, and breathlessness. You get it? Sometimes you get breathlessness. We have said chest pain, that is the first. We go to severe abdominal pain, right upper quadrant, right lower quadrant. We call it the iliac region, right iliac quadrant. When you feel pain that is in the right iliac quadrant and it's radiating to the navel, I just know it is appendicitis. The appendix is undergoing inflammation. So you have to go to a hospital, you do an X-ray or a CT scan or an MRI, you find out if it is ruptured or what is happening so that we can heal you. Be placed in antibiotics or you go for surgery. Let's continue. To calf for leg pain with swelling and redness. On your legs. On your legs, you will get some swelling. You've heard of DVTs, deep venous thrombosis. When your veins are blocked with maybe cholesterol, a clot or so, and the blood is not circulating well, so it is leading to extra fluid retention, extra fluid retention, DVT. Women that are at gestation, mostly they get DVT, and you'll get some pain. Their limbs swell and then they become painful because of retention of fluids. And you may, if you press, you see there is pitting. That is calf pain with swelling and redness. Inflammation, we talk about redness, pain, and swelling. You get it? The signs of inflammation that is given at the medical school at the first year, you remember. We go to pelvic pain and missed periods. Hey, pelvic pain, pelvic. Your pelvic is like this. So above your pelvis here at the angle, you may find pain. To women, you may get, this is called ectopic pregnancies may cause that pain. Ectopic pregnancies. When you get ectopic pregnancies, ectopic means the products of consumption are retained at the tubes and it's not going to the cervix. So it is growing and it may rupture. So as it grows to the tube, you feel pain. It may cause internal bleeding. If you are between the ages of you get it, fertility, and you start getting ectopic pain, pelvic pains, it's good to rush. Maybe it may be even PID, pelvic inflammatory disease, which is so painful. If you have ever had PID for women from the cervix to the pelvis, you really need to get an attention. But mostly it becomes to ectopic pregnancies, and PIDs. Eye pain. Today we are talking about pain in the eyes. I remember when I was doing ophthalmology, there was something called uveitis, inflammation inside the eyes. So acute glaucoma, it may cause, and this may cause loss of vision. There is something called cupping. When the eye fluid that is circulating inside is retained and it's continuing to grow inside, you lose your vision. So eye pain may be because of glaucoma. Today we are just talking about pain. Severe pain after injury. Severe pain after injury, mostly at your sternum, at your back. Internal bleeding or fracture. When you get a fracture, it compresses through the muscles and the nerves. And remember, mostly the nerves follow the blood system, mostly the arteries. So you may feel pain because of the compression of the nerves. So it's very important you do an X-ray and we determine if it's a compound fracture or which type of fracture, or a green stick when we go to children. Yes, persistent bone pain. Persistent bone pain. You have not get an accident. You are just sleeping. Tomorrow you wake up, you have persistent bone pain. What can this be? Infection. Infection. And we have genetics causes like arthritis. Yes, arthritis, osteoarthritis. Those are the kind of pain you get because your bone is not getting enough calcium. It is not balancing enough things that are supposed to make it hard, and it is weak. So you get pain. And remember, there is sometimes your bone can get an infection and you end up getting pus. This is the cause of dull pain and warm pain on your muscles. The pain comes from inside. So you feel pain from inside, but it's warm. But persistent pain. This is mostly at night. You will get that. Those are things that come. And we have some cancers. There are some cancers that you may feel persistent pain and bone pain, and you may be thinking maybe you fell. No, be careful. Go to a doctor. Find out why am I getting at night persistent pain. Or sometimes your bone are just breaking. A condition called osteo imperfect. Yes, those are genetic. And then we have high fevers and stiff neck. High fevers and stiff neck. Imagine at times you wake up, you have high fevers and you're feeling so much pain along your neck. Even turning like this, your head is hard. Suspect meningitis. Meningitis makes your head not to be to be soft. It makes you rigid. We call it knuckle rigidity. Your head is rigid. Meningitis. Meninges is the brain is having infections. It may be fungal, it may be bacterial, it may be viral, but it's important to go to the doctor and find out why you're getting high fevers and your knuckles, you have knuckle rigidity, and why your neck is rigid. And then we go to another type of pain, sudden severe worsening headache. You're just seated working, and then there is a very sudden headache that comes. Bah! You touch your head like this, you it's like you can't. These things you cannot ignore because maybe it may be brain hemorrhage or stroke or even meningitis. You know, stroke is where your brain is not coordinating. Part of your brain is not getting oxygen. So it may be a bigger thing and not just headache. So sudden headaches that come severely, don't ignore them. They may be brain hemorrhage, they may be stroke, it may be even meningitis, but meningitis mostly comes slowly and gradually. So it's very important when you get these things, you find out from the doctors, because when you go to the doctor, there are some things that you do, like you will get some MRIs, you'll get some CT scans, you'll get some blood works, you get it. Like meningitis, we get the CSF fluid, and then we do some things on the fluid, and then we get to determine if it is fungal, if it is bacterial, or it is viral. And then we have another type of pain, which is very funny. This pain is called upper abdominal pain radiating to the back. Upper abdominal pain radiating to the back. Always suspect pancreas problem, pancreatitis. Always suspect pancreas problem. Often it comes with vomiting. Pancreas problems that comes with vomiting. You get it? Then we have another one, sudden testicular pain in men. Sudden testicular pain in men. Just imagine as a man, you're seated down and then suddenly you get some pain that is coming from the testicle, the inguinal region. Hmm? Suspect testicular torsion. When your testicles are twinkled like this, it's called torsion. So they cause the nerve from the testicles to have a very sharp inguinal pain. That is testicular torsion. Don't ignore it. May get your testicles may get ischemic. They may like oxygen, and then when they lack oxygen, you know what will happen. You will lose the potential of being a man. Siring, infertility. This is what we call. And then we have uh, testicular short torsion. Before I go to the next one, needs immediate what? Surgical. It's surgical. It needs to go and be untwangled so that the blood vessels that are going to the testicles can be relieved. You know, if your cells don't get oxygen, the next thing they'll get is ischemia, and then they'll be gangrenous. They'll die out. They will die out. So we got we got another one called back pain with fever and burning urination. Back pain at your flanks. Hold your hand like this and hold your flanks. Back pain with fever, and when you are urinating, you feel burning sensation. Be sure that is coming from the kidneys. They're coming from the kidneys, and it's not a good pain. You need to be very careful of this, because when your kidneys are having a problem, what happens is it starts with UTI. We go to cystitis. After cystitis, you may get something called pyelonephritis. After pyelonephritis, you can get nephrotic syndrome or nephritic syndrome. After those two from the kidneys, what you can get other is acute kidney failure. After acute kidney failure, we go to chronic kidney failure. After chronic kidney failure, next what we get is dialysis. Very bad condition. So when you get flank pain with fever, burning election, please be careful about that. The next pain we are going to is jaw, neck, or shoulder pain. Jaw, neck, or shoulder pain. A typical heart attack, mostly with diabetics. Jaw pain. You know, when you get some jaw pain and some stiff, when you get tetany, the tetanus bacteria, most of the time you get jaw pain. Your jaw is always stuck. You should be careful. Check your doctor. Let the be screened. Get to know what is happening. Jaw pain. Women and diabetics are usually getting this jaw pain, and a typical heart attack. Yes, some jaw pain will be linked to a typical heart attack. Yes. Abdominal pain with black stool, GI bleeding, and ulcers. Abdominal pain with black stool, we call it melena. Melena, when you're bleeding from inside and then your blood is being digested. Be careful, because this may be gastric issues. You know, gastric issues have very many issues. There are so many issues at the gastric, but when you're getting black stool, just know blood is being digested, and it may be ulcerations, corn diseases. There are so many. There are so many that we get in the abdomen. So it's important to check, to get the normal diagnostic tools. You go through them, and then you find out what is happening to you through this. You see, pain is a very broad thing, and when we started, I defined about pain. Yes, we said a tissue that is suffering or emotional damage. Now, here we are talking about tissues, the abdomen, the brain, you get it, the pancreas, tissues. But there is emotional part when it comes to mental. It can cause pain. But now we are at the abdomen. This is a tissues mediated thing. Bleeding and ulcers can cause it. And then we go to weakness plus pain on the side. Weakness and pain on one side. You get your hand is not getting where, is not having the required strength, or you are having some weaknesses on one side, eh? And pain. Stroke, my friend. Stroke. Rush to a doctor to get a diagnostic tool that of choice from your symptom presenting, so that you may avoid some issues earlier. Some things may be prevented before they happen. Yes, stroke, my friend, it's not a good thing. Stroke may come because of many things. There is a place we talked about stroke. Please go to that video, look at it well, to know about stroke. But I repeat it once again about stroke. It's a very important topic. Time is equals to brain. So when you get these weaknesses, run to hospital, get diagnosed, and then you get better. And then we have meningitis. Meningitis is a medical emergency, and yes, we need to we need you need to go to a doctor. And we previously said about meningitis. We talked about meningitis is inflammation of meninges. So if meningitis is inflammation of the meninges, and your brain can die anytime. You see, it is very important to to rush to a doctor to do the same diagnostic, so to lead you to get to know what is happening. Remember, whatever I've gone through around 15 issues, around 15 issues, yes, around 15 issues about pain. But that one does not mean it is classical. If you get chest pain, it's coming from the heart. There are several things that can end up you getting chest pain. And according to a doctor and the diagnostic tools of choice that this doctor has come out with, they will help you to rule out your diagnosis. You get it? So it's important to be going to a doctor to find out what is happening and what is the drug of choice of the procedure of choice to make you not to lose the normal function of your body. You get it? For you see pelvic pains, there are so many, like number 7, which is the pelvic pain. There are so many things that may have you, they may lead you to get pelvic vein. We have talked of cancer, we have talked of ectopic pregnancy, we have got, we call them palmoid. When you go to study gynecology, there's something called palmoid. Those are causes of bleeding and pain in the pelvic region. So don't lose yourself and say these are the normal. No, I've not said that. If you have a question when you have pain, bring it up. Let's see why you're having the pain. And this is nice meet for the topic of today. We have talked about pain. We will find another topic of another day to talk about something else. But if you need or you have a question about whatever that you have talked about, be welcome and let us know about your pain. Remember, emotional pain can lead to tissue damage. I'll tell you why. Emotional pain can lead to tissue damage. So let's meet the other day as we talk about medical issues. Please stay safe, happy always, and be close to everyone. Love is always a good religion. Remember that. Nice evening, nice day wherever you are. good day, good morning, good night, sleep tight.